Anaphylaxis is a severe, potentially life-threatening allergic reaction that can occur within seconds or minutes of exposure to an allergen. Recognizing the symptoms early is crucial for prompt treatment and better outcomes. In this video, we'll walk you through the most common symptoms of anaphylaxis, how they present, and why immediate action is necessary. Whether you or someone you know has allergies, understanding these warning signs can make all the difference. Let's begin by exploring what anaphylaxis is and why it's so important to recognize its symptoms quickly. Anaphylaxis can be triggered by a variety of allergens. The most common triggers include foods such as peanuts, tree nuts, shellfish, and eggs. Insect stings, certain medications, and latex are also frequent culprits. Sometimes, even a tiny amount of an allergen can provoke a severe reaction. It's important to be aware of your personal triggers and to communicate them to those around you. Knowing what can set off anaphylaxis is the first step in prevention and preparedness. One of the defining features of anaphylaxis is how quickly symptoms can appear. Often, they develop within minutes of exposure to the allergen, but in some cases, they may take up to an hour. The rapid progression makes it vital to recognize the early warning signs and respond immediately. Delaying treatment can lead to more severe complications, so being alert to the sudden onset of symptoms is key to managing anaphylaxis effectively. The most common early symptoms of anaphylaxis involve the skin. These include hives, which are raised, red, itchy welts that can appear anywhere on the body. Flushing, or a sudden warmth and redness of the skin, is also typical. Some people may experience itching without a visible rash. These skin reactions are often the first clue that something is wrong, so it's important to take them seriously, especially if they appear suddenly after exposure to a known allergen. Swelling, also known as angioedema, is another hallmark symptom of anaphylaxis. This swelling often affects the lips, tongue, throat, face, and sometimes the hands or feet. Swelling in the throat or tongue can be especially dangerous, as it may block the airway and make breathing difficult. If you notice swelling in these areas, it's a medical emergency that requires immediate attention. Breathing problems are among the most serious symptoms of anaphylaxis. These can include shortness of breath, wheezing, coughing, or a tight feeling in the chest. Some people may hear a high-pitched sound called stridor when they breathe in. Difficulty breathing can escalate quickly and is a sign that the airway may be narrowing. Immediate action is required if any breathing problems develop during a suspected allergic reaction. A feeling of tightness in the throat or a change in voice, such as hoarseness, can signal swelling in the airway. This symptom often accompanies other signs like difficulty swallowing or a sensation of a lump in the throat. These changes should never be ignored, as they can quickly progress to complete airway obstruction. If you or someone else experiences throat tightness or hoarseness after exposure to an allergen, seek emergency help immediately. Some people with anaphylaxis experience nasal symptoms such as a runny or stuffy nose and sneezing. While these may seem mild compared to other symptoms, they can be an early warning sign, especially when they occur alongside other allergic symptoms. Nasal congestion can also contribute to breathing difficulties if swelling progresses. Anaphylaxis can also cause eye symptoms such as redness, itching, or swelling of the eyelids. Watery eyes may accompany these symptoms. While not as dangerous as airway symptoms, eye involvement is another clue that the body is reacting to an allergen. These symptoms often appear together with skin or nasal symptoms. Gastrointestinal symptoms are common in anaphylaxis and can include nausea, vomiting, abdominal pain, and diarrhea. These symptoms may develop rapidly and are often overlooked as signs of a severe allergic reaction. However, when they occur with other symptoms, they point strongly to anaphylaxis and should not be ignored. A sudden drop in blood pressure during anaphylaxis can cause dizziness, lightheadedness, or even fainting. These symptoms are particularly dangerous because they indicate that the body is not getting enough blood flow to vital organs. If someone feels faint or loses consciousness during a suspected allergic reaction, it's a sign of severe anaphylaxis and requires immediate emergency care. Anaphylaxis often causes the heart to beat faster than normal, a condition known as tachycardia. This rapid heartbeat is the body's response to low blood pressure and the stress of the allergic reaction. Some people may also feel palpitations or an irregular heartbeat. Monitoring these symptoms is important, as they can signal worsening anaphylaxis. Feeling unusually weak or tired is another symptom of anaphylaxis. This can result from low blood pressure, poor oxygen delivery, or the body's overall stress response. Weakness may make it difficult to stand or walk, and fatigue can set in quickly. These symptoms, especially when combined with others, should raise concern for a severe allergic reaction. Mental symptoms such as confusion, anxiety, or a sense of impending doom are not uncommon in anaphylaxis. These feelings may be caused by low oxygen levels or the body's stress response. If someone suddenly becomes confused or extremely anxious during an allergic reaction, it's a sign that the situation is serious and requires urgent attention. In severe cases, anaphylaxis can lead to complete loss of consciousness. This is a medical emergency and indicates that the body is in shock. Immediate intervention is necessary to restore breathing and circulation. If someone collapses or becomes unresponsive during an allergic reaction, call emergency services right away. A person experiencing anaphylaxis may develop pale or bluish skin, especially around the lips and fingertips. This is a sign that oxygen is not reaching the tissues properly, often due to airway obstruction or poor circulation. Cyanosis, or bluish discoloration, is a late and dangerous sign that requires immediate medical attention. Profuse sweating and clammy skin are common in severe allergic reactions. These symptoms are the body's response to shock and low blood pressure. If you notice someone breaking out in a cold sweat during an allergic reaction, it's a sign that their condition is worsening and emergency help is needed. Some people with anaphylaxis may experience chest pain or discomfort. This can be due to the strain on the heart from low blood pressure or difficulty breathing. Chest pain should always be taken seriously, especially if it occurs with other symptoms of anaphylaxis. Immediate medical evaluation is necessary. Nausea and vomiting are frequent gastrointestinal symptoms in anaphylaxis. They may occur suddenly and can be severe. These symptoms, especially when combined with others like hives or swelling, should raise suspicion for a serious allergic reaction. Diarrhea can also be a symptom of anaphylaxis, often accompanying other gastrointestinal complaints. It may develop rapidly and contribute to dehydration, especially if vomiting is also present. Recognizing diarrhea as part of the allergic reaction is important for comprehensive care. Abdominal cramps or pain are common in anaphylaxis. These may be severe and sudden, and are often mistaken for other causes. When abdominal pain occurs with other allergic symptoms, it's a strong indicator of anaphylaxis. A unique symptom of anaphylaxis is a sudden, overwhelming sense of impending doom. This feeling can be very distressing and is often reported by people experiencing severe allergic reactions. It may occur before other physical symptoms become obvious and should always be taken seriously. Difficulty swallowing, also known as dysphagia, is a serious symptom of anaphylaxis. It often results from swelling in the throat or tongue and can quickly progress to airway obstruction. If someone has trouble swallowing after exposure to an allergen, seek emergency help immediately. Hoarseness or a change in voice is another symptom that can indicate swelling in the airway. This may be accompanied by throat tightness or difficulty speaking. Any sudden voice changes after allergen exposure should be treated as a warning sign. Wheezing is a high-pitched whistling sound made while breathing. It indicates narrowing of the airways and is a classic sign of anaphylaxis. Wheezing often occurs with shortness of breath and should prompt immediate medical attention. Stridor is a harsh, high-pitched sound heard when breathing in. It suggests significant airway swelling and is a medical emergency. Stridor often accompanies other symptoms like throat tightness and difficulty breathing. Persistent coughing can occur during anaphylaxis, especially if the airways are irritated or swollen. Coughing may be dry or accompanied by wheezing. It's important to recognize coughing as a potential sign of a severe allergic reaction. Some people report tingling or itching sensations in the mouth, lips, or throat as an early sign of anaphylaxis. These sensations may precede more severe symptoms and should not be ignored, especially if they occur after eating or exposure to a known allergen. Redness or flushing of the skin is a common early symptom of anaphylaxis. It may appear suddenly and can be widespread. Flushing is often accompanied by warmth and may be mistaken for a mild reaction, but it can quickly progress. Itching is a frequent symptom of anaphylaxis, even when no visible rash is present. Generalized itching can be distressing and is often an early warning sign. Pay attention to unexplained itching, especially if it develops suddenly. Swelling isn't limited to the face or throat. Some people experience swelling in their hands or feet during anaphylaxis. This can make movement uncomfortable and may be accompanied by tingling or numbness. Swelling around the eyes or eyelids is another visible sign of anaphylaxis. It can occur rapidly and may be accompanied by redness or itching. Eye swelling is often seen with other facial swelling. Swelling of the lips or tongue is a particularly dangerous symptom of anaphylaxis. It can quickly lead to airway obstruction and difficulty breathing. If you notice swelling in these areas, seek emergency help immediately. Throat swelling is a life-threatening symptom of anaphylaxis. It can cause a feeling of tightness, difficulty swallowing, and changes in voice. Throat swelling can progress rapidly, so immediate intervention is critical. Facial swelling is a visible and concerning symptom of anaphylaxis. It may involve the cheeks, eyes, lips, or entire face. This swelling can develop quickly and is often accompanied by other symptoms like hives or redness. Although less common, swelling of the genitals can occur during anaphylaxis. This symptom may be alarming and uncomfortable, but it is important to recognize it as part of the allergic reaction, especially if other symptoms are present. Hives, also known as urticaria, are raised, red, and itchy welts that can appear anywhere on the body. They are one of the most recognizable skin symptoms of anaphylaxis and often develop rapidly after exposure to an allergen. Flushing is a sudden redness and warmth of the skin, often affecting the face and upper chest. It can be an early sign of anaphylaxis and may be mistaken for embarrassment or exertion. Flushing should be considered in context with other symptoms. Generalized itching, even without a visible rash, is a common symptom of anaphylaxis. It can affect any part of the body and may be intense. This symptom often precedes more severe reactions. Difficulty breathing is one of the most dangerous symptoms of anaphylaxis. It may present as shortness of breath, rapid breathing, or a feeling of suffocation. This symptom requires immediate emergency intervention. A feeling of tightness or pressure in the chest is a common symptom of anaphylaxis. It may be accompanied by difficulty breathing or chest pain. Chest tightness should always be taken seriously in the context of an allergic reaction. A rapid, weak pulse is a sign that the heart is struggling to maintain blood flow during anaphylaxis. This symptom often accompanies low blood pressure and shock. Monitoring the pulse can help identify severe reactions early. Low blood pressure, or hypotension, is a dangerous symptom of anaphylaxis. It can lead to dizziness, fainting, and shock. Recognizing this symptom is critical for prompt treatment and preventing complications. Shock is the most severe consequence of anaphylaxis. It occurs when the body cannot maintain adequate blood flow to vital organs. Symptoms include confusion, rapid pulse, low blood pressure, and loss of consciousness. Shock is life-threatening and requires immediate emergency care. To sum up, anaphylaxis is a medical emergency with a wide range of symptoms, from skin reactions and swelling to breathing difficulties and shock. Recognizing these signs early and acting quickly can save lives. If you suspect anaphylaxis, use an epinephrine autoinjector if available and call emergency services immediately. Stay with the person and monitor their breathing and pulse until help arrives. Being prepared and informed is the best way to respond to this serious condition.